Welcome back to Northeast Current. And again, I'm Cathy Rist Strauch, and with me is Dr. Linda Thomas Hemack. And we've been having a nice conversation while you were watching something else. And she's going to fill us in some more on all these incredible changes that are happening right now with our health care. Tell me something else that we were just discussing.
So I think that the, Obamacare, which everyone is kind of afraid of the future of, there's actually a lot of exciting changes being implemented currently. And I don't think there's really a full appreciation of how powerful those changes are for the enhancement of the way that healthcare is delivered and the way that doctors are educated, and also the way that they enable and promote health and wellness. So I think there's a lot of exciting changes. One is obviously consumer engagement that's happening. We've always had consumer engagement in terms of direct consumer advertisement, but that's outside of the partnership between the public and the profession itself. I think the profession is really moving to inspire and activate consumerism, and one of the ways that we're really doing that is through the promotion of electronic health records and patients' access to their own charts.
Right. So if I go to you as a patient and I have all these things happening, you're going to have a file. You're going to create a file. You will create it, or what if I have a file somewhere else?
So we used to have a paper manila envelope called Your Chart, and the doctors owned it, and so that was a complicated dynamic. We are now really, as a profession, finally embracing and moving towards electronic medical records and health information technology and digitalizing information. And that's really important because most of the new electronic medical records, if they are certified by the federal government, who has funded and really incentivized adoption of electronic medical records through the Affordable Care Act or Obamacare, one of the amazing things that happens is that there is public access, very compliant with confidentiality standards that have to be met, to your electronic medical record. And so we have something called a portal, P-O-R-T-A-L, and what that is it's an internet-based, highly secure way that you can access your electronic medical records and communicate with your healthcare delivery office from home or from somewhere other than the office itself. And your electronic medical record is a place where all of your health information can be consolidated. Through the portal, you can actually begin to really review some of the data that's in there, look at your medication list, maybe mention something that you might be taking over the counter, look at your allergy list, know that this new doctor, who might be your adult doctor, didn't know that you were allergic to penicillin when you were a child. You can actually enter some allergies. You can update your family medical history.
Family history, right, because everything is all interrelated.
Right, and I think for parents it's incredibly convenient because you can download and print your child's vaccination records that you might need for school admission processes. I have that all the time. Every year. Right. Give us this. Go to the doctor, bother the doctor, and make sure they sign the form saying they had all these special vaccinations. And right, and I think that and it offers a whole new world to tap into adolescent education, where you can really encourage adolescents, if you have a question, rather than going somewhere where you don't know if you're going to get the accurate information, if it's an elective question, maybe you should go into the portal and into the healthcare delivery system. And so it really has across the age range implications to really promote consumer engagement in healthcare, to unify the delivery system with the needs of the patients, and to do it in a way that's enabled by really high-powered and organized technology.
And I just came up with an idea.
Okay.
I think, because how many times you hear about these John Does out there where something happens, they don't know who this person is, they're in a terrible accident. What if in these files you took maybe an index finger or something, so you have a fingerprint on the file, and they could fingerprint the person to find out who they are?
Yeah, it's kind of interesting that the dental industry has had, identification records forever and a day.
You could do that, or you could just do blood work and you have your DNA, right? So this is the DNA of this person. No one else would have it, right?
Now I feel like I'm on this, like, let's go to the future together.
I know.
It's kind of fun.
This would be fun. That would be another way to do it, like you take their blood sample or something.
And you know, I think that there has been a lot of federal and governmental drives to move in the healthy direction of how can this technology be most useful, and we do take photos. And so your photo is in your electronic medical record. It's taken at the window, and you know, we take them every 5 years because we
change,
unfortunately age and change.
I just get younger and younger every year.
And you know, in children we do them more frequently because the change is so significant during their development, and so you know that we do those annually. So there is definitely power untapped yet in health information technology and records to be beneficial to people when they need it most. You know?
Now I'm thinking, with all this stuff we're talking about, you have a website. Tell us about the website. There's got to be certain things people can go to this website and get more information, right?
So the portal access is actually through the electronic medical record. It is external currently to the Wright Center's website. I should tell you that the Wright Center's website is currently being updated because I do think that one of the other things that's happening is that we're realizing that we should be more engaged in the consumer activation and more engaged in social networking and the internet. And so I think most healthcare industries are moving in that direction. So that's another really positive change. And I think, though, you know, other than consumer engagement and health information technology and web access and partnering, you know, partnering is really big in terms of bringing communities together, partnering resource organizations together so that we can best meet the needs of the public. And the way that that should really be delivered in terms of care, we're getting into real dynamics of high-performing teams to deliver care so that their care could be better coordinated and more strategic and leaner, and that and it can be more organized and team-based and not just dependent on one person. And so those are like the really big changes that are happening because of the Affordable Care Act. We're excited about them. I think the public should know the name medical home because I think it captures all of those changes.
Medical home?
Medical home. Patient-centered medical homes. You know, taking advantage of health information technology, all the members of high-performing teams, and engaging the patients so that you can really move towards high performance, meeting their expectations, and enhancing their health. That's what a medical home is.
Medical home. Now your website is rightcenter.org?
Rightcenter.org.
Right Center. And we'll have that on the screen below us, I'm sure. Right as in W-R-I-G-H-T, Center. So you can't go wrong with Wright Center.
Thank you so much,
Thank
Cathy.
you. Thank you. Now, is there anything else we want to discuss while we're here? I'm thinking if I go to the clinic and I get checked out, then they find out you need an operation. What happens there?
So I think what happens there is a very intense focused effort on what you need, which is care coordination. So care coordination with other partners and other partnering physicians, other partnering resource agencies in northeastern Pennsylvania to advocate as much as possible that we meet your needs as a patient. And so I think care coordination and resource partnerships and navigation of the healthcare delivery system is a really powerful advocacy role of a good medical home.
All right. Well, a lot is happening. So again, go to rightcenter.org and find out more for yourself, how you could take care of yourself if you needed a free clinic, find out what's happening with Obamacare, and I want to thank Dr. Linda Thomas Hemack for being with us. And again, I'm Cathy Rist Strauch, your host here for Northeast Current.